You may have noticed empty shelves at pharmacies right across the GTA, this time though for adult cold and flu medications. Some pharmacists telling City News they are not able to stock their shelves as demand is once again picking up. We also have an update tonight on the shortage of children's antibiotics.
In checking my wholesaler right now, there are very, very few, if any, options available for us to replenish right now.
First, it was kids' pain and fever medications, and then children's antibiotics. And now adult cold and flu meds are in short supply. Jen Belchar with the Ontario Pharmacists Association says there has been low stock of certain brands on and off over the last 8 months, but now the shortage has escalated.
What we're seeing with this is very, very similar to the kids' medications, that it is an exceptionally high demand compared to what we would see typically within a year. And many pharmacies over the course of the pandemic actually had a lot of these products expire on the shelf and had to destroy them. And that may have been true for the manufacturers as well, because what we saw were people were getting less colds and flus in addition to preventing COVID with things like masking and other public health measures.
The drug shortages started being reported when a triple threat virus season hit fast and furious. A wave of kids began getting sick, with many of those cases leading to secondary bacterial infections such as strep throat and pneumonia, illnesses that are treated with antibiotics.
The amoxicillin shortage in Canada is serious. We're seeing empty pharmacies all over the country. The hospitals can't get enough supply, so it's dire.
Since mid-October, parents have been scrambling to fill prescriptions. City News has now learned that by the end of January, Canada should have a 12-week supply of the antibiotic for children. President and CEO of Juno Pharmaceutical says his company is one of several working closely with Health Canada and has secured 100,000 units of international supply.
Today, we are focusing on making sure that the hospitals have access from a critical care perspective first, particularly the pediatric wards for children. And then we will be facilitating the movement of material and amoxicillin antibiotic into all of the pharmacies across the country.
The federal government recently secured a couple million bottles of children's acetaminophen and ibuprofen from other countries after months of empty shelves. And with flu, RSV, and COVID still circulating, pharmacists right across the GTA continue rationing that supply.
Ultimately, we're still not in a situation where we could say that the shortage is over or that there's adequate supply. There's still high demand.
Now, there are indications that the flu season may have peaked here in Ontario. Well, RSV peaked about a month ago, but COVID cases are on the rise right across the country. One reason that could be driving up demand for cold and flu meds.